Why do nurses wake you up all night? Here's the real reason you can't sleep in the hospital. Have you ever spent the night in the hospital and thought, goodness, every time I fall asleep, somebody else walks into my room. First, it's your nurse. Then somebody comes in to check your blood pressure. Then the lab comes in. Then respiratory therapy comes in. Then another nurse needs to scan your bracelet. And then your IV pump starts beeping. And by morning, you are completely exhausted and wondering, if sleep is supposed to help me heal, then why won't anybody let me get some sleep? As a registered nurse with over 25 years of healthcare experience, and also experienced as a patient myself, I completely understand why you feel this way. And believe it or not, most nurses hate waking you up just as much as you hate being awakened. We know you're tired. We know you're uncomfortable. We know that sometimes you have only been asleep for 20 minutes before somebody else walks through your door and wakes you up. But most of these interruptions are happening for really good reasons. So today, I'm going to explain why nurses wake you up throughout the night, which interruptions are truly necessary, which ones may sometimes be avoidable, and what you can actually do to get more rest during your hospital stays. One of the biggest misconceptions that patients have is that hospitals are basically hotels with medical staff. It is not. A hospital is an intensive monitoring environment. And in most cases, you are not there just to rest. You are there because something about your health needs to be watched, treated, investigated, or stabilized. Even when you are feeling fairly comfortable, your health team may still be watching for changes that you're not able to feel yet. A person can look fine, speak normally, and say they feel okay while their blood pressure is slowly dropping. Their oxygen level may be falling. Their heart rhythm may be changing. Their blood sugar may be moving into an unsafe range. They may be developing bleeding, infection, confusion, or a reaction to a medication before the symptoms become obvious. And this is why hospitals rely so heavily on repeated assessments. Your care team is not only treating what has already happened, we're trying to catch any next problems before they become an emergency. And unfortunately, your body does not stop changing just because it's nighttime. One of the main reasons your nurse comes into your room overnight is to assess you. A nursing assessment is not something that happens one time on admission and then never again. We're constantly reassessing throughout your stay. Your nurse may need to check your breathing, your heart rate, your level of consciousness, your blood sugar, your incision, your pain, your IV, your urine output, your swelling, your circulation, your skin, or your ability to move safely on your own. And sometimes we're assessing you before you even realize it. So when we walk in and ask, how are you feeling? Do you know where you are? Are you having any pain? Do you feel short of breath? These may sound like ordinary questions, but while you are answering, your nurse may also be watching your speech, watching your breathing, checking your orientation, looking at your skin color, and noticing whether you may seem more sleepy, confused, weak, or just different than you did before. A change from your last assessment can be a very important clue. Maybe you were alert at 10 p.m., but now you're difficult to rouse. Maybe your pain was controlled 2 hours ago, but now it's suddenly severe. Maybe your breathing sounds different. Maybe your surgical dressing has more drainage than it did before. Maybe you were able to walk to the bathroom earlier, but now you suddenly feel dizzy when you stand up. These changes can completely alter your plan of care. So when your nurse wakes you up, to ask questions, shine a light briefly, listen to your lungs, check your incision, or look at your IV, it is because we need current information, not information from 4 or 6 hours ago. Another major reason you are awakened is for vital sign checks. That usually includes your blood pressure, your heart rate, your respiratory rate, your oxygen saturation, and your temperature. My patients often say, "My blood pressure has been fine all day. Why do you have to check it again?" Because vital signs can change, and the pattern of your numbers often matters just as much as any changes. One slightly abnormal reading might not matter much, but a blood pressure that keeps trending downwards can be a warning sign. A heart rate that continues climbing may point to pain, dehydration, bleeding, infection, or stress on the body. A rising temperature may be the first sign of infection. A dropping oxygen level may happen before you feel severely short of breath. After surgery, nurses are especially alert to changes in blood pressure, breathing, pulse, oxygen level, pain, and your mental status. Anesthesia, pain medication, blood loss, fluid shifts, and the stress of surgery can all affect the body for hours and hours afterwards. Patients receiving strong pain medications may also need closer monitoring because some medications can slow breathing or make patients feel unusually sleepy. If you are in the hospital for a heart problem, breathing problem, infection, stroke, or surgery, or another unstable condition, your vital signs may need to be monitored every 4 hours, every 2 hours, every hour, or even sometimes more often depending on physician's orders. So yes, it can feel excessive, but those repeated checks are often what allow our team to catch problems early. Now, let's talk about one of the most unpopular hospital traditions, the 4 a.m. blood draw. Patients understandably ask, "Why on earth does the lab need my blood at 4 in the morning?" Well, there are a few reasons. Many doctors begin reviewing patient results very early in the morning before they begin making rounds. If your blood is drawn at 4 or 5 a.m., the results may be available for the medical team before they come to your room. Those results can affect whether you are discharged, whether a medication is changed, whether you need more fluids, whether you need electrolytes like potassium and magnesium, whether your blood count is stable, or whether additional testing may be needed. For example, after surgery, your care team may want to know whether your hemoglobin has dropped, which could signal bleeding. If you are receiving certain medications, they may need to check your kidney function or electrolyte level. If you have an infection, we may be watching your white blood cell count. If you have diabetes, we may be monitoring your blood sugar signals. If you are on blood thinning medication, certain lab values need to be monitored closely. The early timing helps hospitals and doctors make decisions earlier in the day. That does not mean that every single patient needs blood drawn before dawn every single morning. Sometimes tests are ordered automatically and may no longer be necessary. It is completely reasonable to ask your doctor or nurse, "Do I need blood work again tomorrow morning? Are these tests still necessary every day? Can any of my lab work be done a little bit later?" There may be a medical reason the timing cannot change, but sometimes the care team can reduce unnecessary testing or adjust the schedule. Medications are another common reason we nurses wake patients up overnight. Some medications must be given at exact or carefully spaced intervals. Antibiotics may be scheduled every 6, 8, or 12 hours. Blood thinners may be ordered at specific times. Pain medications may need to be given before pain becomes severe. Insulin and blood sugar checks may follow a strict schedule. Some heart medications, seizure medications, steroids, breathing treatments, or IV medications simply cannot be delayed until morning. Hospitals also try to keep medication levels steady in your bloodstream. If a medication is meant to be given every 6 hours, skipping the middle of the night dose could make it less effective or allow symptoms to return. There are also medications that are scheduled because of how they interact with food, procedures, lab work, or other drugs. That said, not absolutely every medication needs to be given at 2 in the morning. Sometimes medication times can be adjusted. If you are being awakened for something that you normally take at home in the morning, ask your nurse if the schedule can be adjusted. But do not refuse medication without understanding why it was ordered. But it is absolutely appropriate to ask, does this have to be given right now, or can this be rescheduled so I can sleep longer? Is there a medical reason it's ordered for this hour? Your nurse can review the order and sometimes contact the pharmacy or physician if the schedule seems unnecessarily disruptive. And this is one of the reasons that I recommend you bring a small notebook and pen with you to the hospital in order to write down these types of questions. It's something that you'll remember to pack if you click the link down below and grab your free hospital packing checklist that I've put together in order to make you feel like a more informed, capable patient. And while you're down there, please hit the subscribe and follow buttons so the algorithm will start showing you more of my videos and you can learn more about how to be confident and capable in your own healthcare. Now let's get back into why people like me keep people like you awake all night in the hospital. Sometimes nurses enter your room because we're checking on your safety. If you're at risk for falling, we may need to make sure that you're not trying to get up on your own. That is especially important after surgery, sedation, when taking pain medication, if you're feeling weak, dizzy, confused, or you're connected to a whole bunch of hospital equipment. You may feel capable of walking to the bathroom, but your blood pressure may drop when you stand up. Your legs may be weaker than you expected. You may trip over IV tubing, oxygen tubing, drains, or compression devices. We would much rather wake you up and help you to the bathroom than find you on the floor. Patients may also be checked on more often if they are confused, restless, pulling at tubes, or trying to leave the bed. In most situations, staff members must document regular rounding. We may check whether you are breathing normally, whether your bed alarm is activated, whether your call light is in reach, whether your IV is running properly, and whether or not you need to be repositioned. If you can't move well on your own, we may need to reposition you ever so often in order to avoid pressure injuries. Nobody enjoys waking a sleeping patient to reposition them. But prolonged pressure on the skin can cause serious wounds, especially in older adults, patients who are very ill, those who are underweight, those who are overweight, poorly nourished, or unable to move independently. Sometimes it is not the nurse who is waking you. Sometimes it's the equipment. IV pumps beep when the medication is finished, when the tube bends, when the IV is blocked, or when the pump detects pressure. And believe me, it drives your nurse crazy too. Oxygen monitors beep when the sensor moves, when your hand is cold, or when your oxygen level drops. Heart monitors alarm when there is a rhythm change, but they can also alarm when a sticker comes loose. Compression devices may inflate and deflate around your legs. Bed alarms may go off when you shift your weight or try to stand. Person in the next room may have equipment that's alarming too. And every alarm has to be evaluated. Nurses cannot safely assume that a beeping alarm is probably nothing. Even when an alarm turns out to be caused by a loose sticker or bent IV tubing, somebody still has to put eyes on and check. That's one of the major reasons hospitals can feel so noisy, even in the middle of the night. There are actually teams working to reduce what's called alarm fatigue, the problem of having so many alarms going off that it becomes overwhelming for the healthcare team and for patients. Many hospitals continually adjust alarm settings, improve equipment, and develop strategies to reduce unnecessary alarms while keeping patients safe. It's an ongoing challenge because the point is to reduce alarming without ever missing something that may save somebody's life. Unfortunately, there isn't always a perfect balance. Now, we've talked about why all of these interruptions happen. Let's talk about what you can actually do to improve your chances of getting more rest. First, ask questions. If something wakes you repeatedly, ask if it's truly necessary. You might say, do I still need to have my vital signs checked every 4 hours? Are daily lab draws still necessary? Could any of my medications be scheduled during the daytime instead? Sometimes the answer will be no, but sometimes your doctor or a nurse can adjust the schedule. Second, let your nurses know what helps you sleep. Maybe you don't normally wear earplugs, but maybe you should consider bringing them to the hospital. Fun fact about me, I actually got earplugs implemented on my med-surg hospital floor for my patients. Just wanted to throw that in there for you guys, fun fact. Maybe you use a sleep mask. Maybe you usually sleep with a small fan for white noise. Maybe you usually take melatonin at home. Those are all reasonable things to discuss with your healthcare team. Third, ask whether some of your care can be clustered. Whenever it's medically appropriate, nurses often try to combine several tasks into one room visit. Instead of waking you 4 separate times over the next hour, maybe they can check your vital signs, help you to the bathroom, give you your medicine, assess your IV, and change your bed sheets all during the same visit. It isn't always possible, but we do try. Also, don't be afraid to tell your nurse that you've had a terrible night. If you've only slept an hour or 2, that information actually matters. Sleep affects healing. It affects pain. It affects blood pressure. It affects mood. It affects confusion, especially in older adults. Knowing that you're exhausted helps your healthcare team make better decisions regarding your care, especially where appropriate. Finally, remember that the people waking you up are not trying to make your night harder. We're trying to help you get well enough to go home. I know it doesn't always feel that way at 3 o'clock in the morning when you're finally asleep and somebody walks into your room, turns on the light, wraps a blood pressure cuff around your arm and says, I'm sorry, I just need to check a few things. It's frustrating. I've been the nurse standing at your bedside, and I've also been the patient in the hospital struggling just to get some sleep. So I truly understand both sides. Most nurses are constantly balancing 2 competing priorities, keeping you safe and letting you rest. Whenever we can safely let you sleep, we absolutely want to. Because we know that healing doesn't just happen through medications and procedures. Healing also happens through sleep. Sometimes we simply have to interrupt that sleep to make sure your recovery is still heading in the right direction. And hopefully now, the next time you hear that familiar knock on the hospital door in the middle of the night, you'll understand a little bit more about what's happening on the other side. This video helped answer a question you've always wondered about. I'd love for you to join our community. Here on The Nurse Next Door, I make videos that explain what really happens in hospitals, surgeries, doctors' offices, and during recovery, in plain English without the confusing medical jargon. If you'd like to feel more confident the next time you or someone you love needs medical care, click subscribe so you don't miss future videos. Thank you so much for watching, and until next time, take care of yourself and your loved ones.